record. All right, so hi everybody. I'm super excited to chat with you today with Dr. Rothaus here of Rothaus MD, who's also our incredible partner down at Modrn Sanctuary. Hi, Dr. Rothaus.
Hi, Alex. How are you doing?
I'm good.
Thank you for inviting me.
Yeah, I'm super excited because Dr. Rothaus and we have a lot of commonalities in things that we like to treat. And then there are also things on different spectrums that maybe we don't always agree on, like crystals, but that's okay. And one of the things that we got into a conversation about recently was TMJ, bruxism, jaw clenching, teeth grinding. And what we realized is that we both treat this from two very different angles. And I had not realized that so many people utilized botox to help them treat TMJ. And I wanted to chat with you about that, Dr. Rothaus, and then share also some of the ways that we're helping in the hypnotherapy world to treat TMJ too. So can you tell us a bit about how you utilize botox to treat TMJ?
Well, certainly we're seeing more patients who are asking for Botox in treatment of bruxism and their TMJ than we did pre-pandemic. Okay. And I don't think that as a plastic surgeon, I am probably the first person people think of or should go to in order to treat their TMJ. And Alex, you haven't said how you do treat TMJ, but I am assuming it is something with hypnosis or meditation or something on that order, which I think is great. If you told me it was crystals, I would wonder a little bit, but I'm glad it's something like that. And I think if you have TMJ, your first line of defense, so to speak, would be to go to your dentist, because often, they can treat that with a simple bite plate or something appliance such as that. However, unfortunately, during this pandemic, many people are experiencing anxiety and tension, and this is reflecting in how they sort of hold their jaw and clench and grind at nighttime when they're sleeping. They're unaware of it, but dentists are seeing an incredible increase in the numbers of patients with not only TMJ pain, but also fracturing and even loss of teeth. So I'm seeing these patients who are basically failures of appliances and other therapies coming to the office looking for some sort of help. Botox has been used to treat the masseter muscle, which is the muscle that runs from your cheekbone to your jaw and helps with chewing. Okay, and people have used it for cosmetic reasons, because if a man or a woman had a big masseter, sometimes it makes the jaw look too square, and they want a little more of that type of V-shaped angle to their face. That's found to be more aesthetically appealing. So people have used Botox to sort of weaken and reduce the size and volume of the masseter muscle to improve facial aesthetics. In this case, however, what we're doing is we're using Botox to weaken the masseter muscle to decrease grinding and reduce the incidence of TMJ pain, grinding down of your teeth, fractures of your teeth, and loss of your teeth. It is a really simple. Alex, I'll give you a chance to ask the question in a second. Sorry, I can see you wanted to say something, and I kept talking. Well,
It's good.
So it is actually a really simple process. It usually requires 3 to 4 injections on each side. You ask the patient to clench down. I can really feel the masseter. It runs from your cheekbone or your zygoma down to the mandible, your jawbone. And you can feel the muscle. If you do it to yourself, Alex, clench down, put your hand there. And you can, if you clench and relax, you can feel your muscle there. It runs this way. So if you put your fingers this way, you can really feel it. You'll feel it between your fingers. And can you feel it? Okay.
Yeah.
Okay. See, I can send you some Botox. You can treat yourself now.
Oh my God.
So
I don't know if I touch myself with the needle.
Anyway, so you feel it, and then you just inject a little Botox in each side. Frequently, the patients are really anxious about this. First time we do sort of Botox light. I don't put a whole lot of units in there and see how the patients respond. And I will often see them come back fairly early on. But it should last in the beginning about 2 to 3 months. Patients get remarkable relief. They're really happy about it. Some of the patients have commented on that. They even think the appearance of their face has improved. But the most important thing is they're not grinding anymore. They're not getting fractures and teeth falling out. Yeah. Anyway, that's it.
Yeah, teeth falling out is not a great thing to have to you. Yeah, I can, it's interesting to talk about, do you have to do both sides? Like I know when I get TMJ, it is predominantly on my left side, but you would normally treat both sides?
Usually you definitely can see patients who are bigger than one side or the other, but both of them feel prominent. So for example, this week I had a patient who had the biggest masseter I had ever seen, literally looked like a chipmunk on each side, but one side was bigger than the other. And I put more product and more Botox in that side than the other. And Botox is not, I don't want this to be an advertisement for Allergan or Botox. Botox is not the only neurotoxin, and basically, all the others such as Dysport and Zeman, et cetera, and there are multiple ones, will work as well.
That's super cool, because I think for a lot of my clients that I see for TMJ, I suffered from TMJ all through high school, college, and then onward. And I ended up seeing a doctor, it was a dentist, who injected what he said was a muscle relaxer. Now that I'm listening to you talk, I think it probably was Botox.
Probably.
But what a difference it made. But I also wanted to treat like some of the symptoms that were causing it. And as I went through hypnotherapy school, we learned a lot about body syndromes and symptoms of when stress can't be released from the body, because we can't turn on or off our fight or flight mechanisms when they happen, that they present in different ways. And one of the ways that if it's stress related, it presents is in the jaw through teeth grinding and clenching. And a lot of the times we'll look at these body syndromes to sort of help us understand on a more subconscious level what's happening with TMJ and jaw clenching, as long as there's no medical etiology as to why someone has it, such as your jaw is out of line or something, there's a medical issue, we'll look in the line of indecisiveness or things that you're not able to say or express yourself properly. But, a lot of it does come from stress in the shoulders. And so a lot of the work that I'll do with hypnosis is having clients take away that added stress from the muscles and to get them to release. Now, a lot of clients that I see get a great deal of relief from this, but if they're not getting that movement, I think that the next more aggressive step would absolutely be going to see Dr. Rothaus to get some Botox injections, because it really does help. And sometimes I know personally, like sometimes the relaxation helps take the edge off, but it doesn't really get the muscles to unknot. And I agree, like sometimes the dentist isn't always the best place to stop your treatment, because when they gave me a grind plate, I actually started grinding more because I'm a clencher. And then when they put the plate in, I ended up like chewing right through it, and it made it even worse. So I think it's really interesting to tackle all these things from two different ways. And again, if you are someone who's nervous about needles, Dr. Rothaus and I are really working to integrate into our treatments together, both approaching it from the mind and body, so that if you are nervous about needles, we can provide you a hypnosis recording or a meditation beforehand. If you want to do a massage afterwards to relax, also it's an option to do at Modrn Sanctuary, but treating both, yeah.
And I want to make it clear the needle we use is really tiny. Okay, yeah. It's a really small needle stick. But also, I also want to make it clear to everyone that they should see their dentist first and make sure that there is nothing from a dental point of view that has to be done. So I think what Alex does could certainly be done in conjunction with that, but probably before you see me, the plastic surgeon, that you probably should go the dental route and make sure there's nothing else there.
Agreed, completely agreed. Step 1, everyone, self-diagnose. Step 2, see your dentist. Step 3, you can try the hypnotherapy. It's a recording, it's on YouTube. You can ask me, DM me for it. You can try it. Step 4 would then be go see Dr. Rothaus. And step 5, feel great. Pretty simple.
But as a physician, step 1, I don't know, a lot of things, self-diagnosis is not necessarily the best thing. Okay, if identify, maybe self-identify. Identify the problem, identify a problem, then go to the dentist or the doctor. Okay, all right.
Right, exactly. And stay off the Google well, because it will totally give you worse anxiety. But if you have any questions, please feel free to reach out to us at Modrn Sanctuary. Either ask for myself or Dr. Rothaus. We'd be happy to help you out. Anything else you want to say before we sign out?
No, I think that's pretty good for our inaugural co-Zoom here together.
Well, then we will see you all back.
Bye-bye. Take care. Bye.
Modrn chat line.